Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So, on today's episode, we will be talking about a commonly brought up and asked about topic, sundowning, also known as sundowning syndrome, and you may also hear people refer to it as sundowners. Now, this will be a two-part series. In this first part, which will be this episode, we'll be defining sundowning and its potential contributive factors. Now, I personally believe that to best respond to sundowning, you have to have kind of like a basic foundational knowledge regarding why it may be happening to begin with. And that will give you a good reference point for where to start. In the second part, we will talk about practical strategies that you can do and implement to decrease behaviors that may be associated with sundowning. And though it may be tempting to just wait or skip ahead to the strategies, I really do think that you will find this episode interesting and helpful, okay? So if you're ready, let's go ahead and get started. So I want to first start by giving you a quick example of sundowning that was shared by a caregiver, okay? So it says, my mom is very alert in the day, but as night comes, she starts with the frustration, crying, anger, talking to herself for very long periods of time, and then in the middle of the night, seeing things. I am so tired. I don't know what to do. Now, can any of you guys relate to the situation that this caregiver is going through? I'm sure many of you can, or at least have a unique situation of your own going on. So what exactly is sundowning? So the good thing about the name is that it kind of defines itself. So essentially what sundowning is the exacerbation of behavioral symptoms that worsens in the afternoon or evening hours. So basically as the sun goes down, sundowning. And it's most often seen in elderly people with or without dementia, or those with some type of cognitive impairment. And again, you're going to notice this near the hours of sunset, and the behavior changes can continue into the night. So really, the most distinctive characteristic of sundowning is going to be the timing of these behaviors, okay? Now, some of these behaviors can include things like increased confusion and disorientation, anxiety, agitation, aggression, wandering, yelling, ignoring directions, or not following them as well as they were in the earlier morning hours, delusions, or hallucinations. And there can be several contributing factors to sundowning. And unfortunately, because sundowning is not well understood, it has been indicated as a common cause of the institutionalization of older people with dementia, and people with dementia are often over-medicated because of sundowning. So let's talk about some of the factors that have been associated with the occurrence of sundowning. So there are neurobiological factors, pharmacological factors, physiological factors, medical factors, and environmental factors. And I don't want you to get too caught up in, what falls under which category, because honestly, depending on the source you reference, they will group them a bit differently as some categories can overlap, okay? Now, just to give you a heads up, there will be some fancy terms and a little blah, 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 but I'm going to try to break it down the best I can for you, okay? So let's start with the neurobiological factors, which are factors referring to the impact of the nervous system. Now, there are no causative factors that have been clearly identified per se. Remember, I said that sundowning is still largely misunderstood, and this goes for the medical community as well. But there have been several hypotheses proposed. So, some of those include degeneration of the suprachiasmatic nucleus, which is thought to be concerned with the regulation of physiological circadian rhythms, so that internal clock, decreased melatonin production, disruption in circadian rhythms, impaired cholinergic neurotransmission, which refers to the binding of acetylcholine to acetylcholine receptors, and too little acetylcholine is believed to cause a decline in cognitive abilities and memory. And so, if you didn't know, many of the drugs prescribed to manage some of the symptoms associated with dementia, like Aricept, Exelon, and galantamine, they work by preventing an enzyme called acetylcholinesterase from breaking down acetylcholine, which allows for higher levels of acetylcholine to remain in the brain, which is good. But of course, we know that the effectiveness of these medications vary from person to person, okay? And then the final neurobiological factor that I'll mention is the dysregulation of the HPA axis. So the HPA axis is just an easier way to say the hypothalamic pituitary adrenal axis, right? So HPA is so much easier. And it's basically like our central stress response system. It's this intertwining of the central nervous system with the endocrine system. And so the proper functioning of the HPA axis is crucial in helping us deal with stressors. So when this system is not functioning properly, what you may see are things like fatigue, difficulty sleeping, brain fog, low appetite, and other things like that, okay? So now let's transition to pharmacological factors. So pharmacological factors would include things like antipsychotics, anticholinergics, antidepressants, hypnotics, okay? And so it's not so important to remember all these different medications, right? But it's important to remember that every medication has the potential of causing side effects, some more than others. And so some medications can cause restlessness, confusion, worsening cognition, and even induce emotional and behavioral changes. So these are definitely things that you want to keep in mind and why it's so important to always keep a medication log, especially for when your partner has changes in medications like a new medication being added, or a dosage or frequency being changed, or a medication's discontinued, because it will be so much easier to see if changes in your partner's behavior may be linked to some medication change, okay? So moving on to physiological factors, meaning factors related to the body and its physical and chemical processes or functions, okay? So some examples of physiological factors are fatigue, hunger, unmet physical or psychological needs, changes in body temperature, changes in blood glucose levels. So if your person is diabetic, this is going to be something to be especially mindful of. And then changes in blood pressure. Now, I don't know about you, but when I'm hungry or when I'm tired, I do not function at 100%. I'm like a completely different person. If I'm hungry, I'm honestly not the most patient. I'm probably not the most nicest. I'm just being honest. If I'm tired, I can't think straight sometimes. And if I stay up too late, I start speaking a little gibberish and slurring my words. And so this is not too far off from what is happening during sundowning if the cause is more physiological in nature. Because when the state of your body is different, the way you act can be different, right? So as just a basic example, when someone has a fever, they may have things like cold sweats or a headache, but we also know that when a person has a fever, it can cause confusion and irritability. So that's a good example of when the state of the body is different, our behaviors can be different as well. Another example is when, say, someone's having fluctuations in their blood sugar. And this can be whether you have diabetes or not, okay? But you'll notice that the person will start acting a little bit different with those changes. So, changes in blood sugar levels in the body results in changes in the way that the person behaves, okay? So does that make sense? The next factor that I want to discuss are medical factors, such as pain, depression, visual or hearing impairments, sensory deprivation, sleep disorders, mood disorders, or cognitive deficits. Now, these factors can all influence a person's behavior irrespective of the time of day, as can other things we mentioned, but they can also worsen as the day goes on and as the person gets more tired, okay? And then the last contributing factor that we'll talk about is environmental factors. So here think inadequate exposure to light, or lack of attention, which may contribute to needs being unmet, or tired or anxious caregivers. Because remember, we as caregivers largely act as mirrors, if you will, and that our partners observe our body language for cues on how to respond to their environment. Okay? Then things like environmental clutter and overstimulation can also play a role. So I want to give you a quick example of how the environment can play a role in sundowning. So a few months ago, I was working with an elder gentleman who had dementia. And to be quite honest, the home was really cluttered. There was pretty much stuff everywhere, especially in the living room and bedroom. And the home didn't have the greatest natural light because the windows were small and curtained. So the only light they really had to work with were the yellow lights from the ceiling fan and then the light from a small lamp that they had in the corner. Now, the clutter already had him quite anxious during the day, He would always say, I don't know why all these people are here. And then he'd point at the piles of laundry or the stack of papers or the boxes that were in the home. But at night, as the sun went down, his anxiety worsened as the light in the home was even more poor, now receiving only dim light from the ceiling fan and the little lamp they had in the corner. And now he became more afraid to fall. He was quite agitated too, as he didn't understand why there were still so many people in his house. And then he'd start fussing at his wife, telling her to tell them to go home, and he got increasingly frustrated as she did nothing about it, because of course, the only way for those people to have gone home was for her to clean up the house. So as you can see from this example, his behavior was largely induced by the environment. So you have to be really mindful of the environment, as it can be filled with so many triggers in and outside of sundowning, okay? So what do I really want you to take away from this? So the most important takeaway from this is not that there are neurobiological, pharmacological, physiological, medical, environmental factors, or what so have you, but more so that there are many things, either in combination or in acting alone, that can be contributing to sundowning. Just as with any behavior, there can be so many factors that are contributing to it, okay? And so with sundowning, it's our job to try to figure out what is triggering the behavior as the day falls into night, and then finding ways to intervene at that level. So that's what we'll be talking about in next week's episode. In the meantime, if your partner is sundowning and if you're down for participating, I want you to try to keep a 5-day log of your partner's activities from the time that they wake up until the time that they go to bed, okay? And so some of the things that I want you to pay special attention to are the time that they woke up, and when they were sleeping, was it restful or not? Because that might be important depending on your person, okay? Other things I want you to pay attention is to the activities or lack thereof that they participated in, the food and water they consumed or didn't consume, okay? Did they take a nap or did they miss their nap if they're used to taking naps? Did they take their medications as scheduled? Did they have adequate exposure to sunlight or bright light during the day? And what complaints or requests did they have, if any, okay? I also want you to make additional notes about the environment, including people, clutter, noise levels, okay? And so the next goal will be to identify the time or time range that the behaviors start. So when do the behaviors kind of come up a notch, Then I want you to think about what is currently going on around that time, as well as what they used to do at that time before they were diagnosed with dementia. So for some people, they may have been picking up their child from school, maybe getting off of work or going into work if they worked later shifts. They might be about to start cooking at that time or what so have you, okay? Because what you may notice is that their need or desire to do what they've always done, although they might not be doing it any longer, will kick in around that time and kind of lead to this downward spiral because they feel this need to do something. Sometimes they'll tell you, I need to do this, I need to do that. Or sometimes they just start pacing and wondering because they feel like they should be doing something, okay? So let's do this for 5 days. So essentially, keep a diary, of the happenings of the day, and you're going to want to keep timestamps as well. They don't have to be super specific. You can round, you can do whatever's easiest for you so it's not super stressful. But just keep a diary, and I will meet you back here next week if you're listening when this podcast is first posted, or in the next episode if you're joining us down the road. And then we'll talk about analyzing your results, kind of what you found in your diary that you were keeping for 5 days, and practical ways to address sundowning behaviors, okay? So as I always say, I hope this podcast was interesting and informative and that you learned something of value. If you have anything you would like to share or tell us, if you would like to email us your diary when you finish so that we can help you figure things out, you can email us at podcast@whatthedementia.com. So again, thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, carry on, and remember, you are not alone. Bambu Care is always here.